Alterations in the reproductive system, part 2. We're going to start with the normal male. We have a picture, here that shows the normal male from the side. Disorders of the male reproductive system. You can have disorders of the urethra. You can have urethritis, which is a sexually transmitted inflammation, which causes burning, tingling, frequency, and maybe a purulent discharge. Reiter's syndrome is where you get urethritis, conjunctivitis, and arthritis that's due to chlamydia, because men don't necessarily always wash, well, men aren't alone, but with Reiter's syndrome, it's the male, so they don't wash their hands after they urinate and then scratch their eyes, so they end up with conjunctivitis or chlamydia there. Urethral strictures, we've already talked about with the renal system, but that can be due to trauma, untreated infection, renal failure, and hydronephrosis. Symptoms are a decrease in urinary stream, frequency, and hesitation. Disorders of the penis. You can have priapism, which is a prolonged penile erection not associated with arousal. This is a medical emergency if it's not treated, and it will cause an impotence. It is associated with spinal cord trauma, pelvic tumors, leukemia, but it can also be idiopathic. Balantitis is inflammation of the glans penis, and this is associated with poor hygiene and phimosis. Phimosis is an inability to retract the foreskin. Again, this is associated with poor hygiene and infection. I cared for a 98-year-old patient who came in for a circumcision to prevent this from causing a problem. Paraphimosis is the inability to return the foreskin to the reduced position, in other words, pulling it back to where it belongs. If you do not do this after putting in a catheter or doing Foley care, and you leave the foreskin retracted and don't pull it forward, it can swell and cause ischemia. And I took care of a gentleman who had to have amputation of the tip of his penis because of this. He wasn't pleased. Not at all. Penile cancer is a usually squamous cell carcinoma in origin. It is very rare. It tends to occur in men between 50 and 70, blacks more so. It doesn't occur as often if you've been circumscribed. Risk factors are the human papillomavirus, infection, smoking, and for some reason, if you have psoriasis. I really don't know why. Disorders of the scrotum, you may have a varicose, which is, you can see the dilation of the veins. They're described as a bag of worms. Hydrocele, which is a picture is here, shows fluid within the tunica vaginalis. It's a congenital form, it often resolves spontaneously, but it can also result from trauma or infection or be idiopathic. Spermatocele is the cyst of the sperm located between the epididymis and the testes. This is usually asymptomatic. Cryptorchidism is where one or both of the testes fail to descend into the scrotum. The testes are in the abdomen, within the inguinal canal, or above the scrotum. If it's untreated, it will result in a decrease in sperm count or infertility. It can be congenital, and it does increase the risk of testicular cancer. Testicular cancer is very rare, but the cure rate is almost 95%. It is the most common solid tumor of young men between 15 and 35. The cause is unknown, but you get a painless testicular enlargement. You get a dull ache in the lower abdomen. You need to check for this once a month in the shower. I don't know if anybody knows Robert Ulrich, but he was an actor who did Spencer for Hire on television along with several other TV things, and he developed testicular cancer, and unfortunately it had metastasized before he had anything done about it. It needs to be taken care of. Scott Hamilton, the skater, developed testicular cancer. It was the size of a grapefruit before he went to the doctor. Gentlemen, I don't understand how you can let something hanging between your legs get that large before you go see somebody. Anyway, he did have a 100% cure rate and has had several children since then, so it has not affected his sexuality in any way. Torsion of the testes is a surgical emergency because it actually twists the testes and decreases the blood supply to them. It causes pain and swelling if it's not relieved with support or rest. It tends to occur more in adolescence. Orchitis is an acute inflammation of the testes. If it's due to an infection, the most common cause is mumps. The onset is sudden, about 3 to 4 days after the mumps. Symptoms are fever, about 40 degrees centigrade, erythema, edema, and tenderness of the scrotum, an increase in your white blood cell count. It can cause infertility if it's bilateral in nature. Epididymitis is inflammation of the epididymis. It's sexually transmitted with Neisseria, or it's non-sexually transmitted with either E. coli or Pseudomonas. Symptoms are acute pain due to inflammation, pyuria, bacteriuria, the scrotum is red and edematous, tends to occur mainly in young males. Complications are abscess formation, infarction of the testes, which definitely would result in infertility. Disorders of the prostate. Benign prostatic hyperplasia or hypertrophy occurs in 80% of the men over age 60. The gland will compress the urethra, causing bladder outlet obstruction due to hyperplasia. Symptoms are a delay in initiating the stream, frequency, decreased force of urination, as I said, the gland compresses the urethra, causing bladder outlet obstruction due to hyperplasia. Symptoms are a delay in initiating stream, frequency, a decreased force of urination, and an increase in your prostate-specific antigen or PSA. This is showing BPH. You can see how the gland has enlarged. Prostate problems are no fun. According to the memory book, you've got frequency, your urgency, and nocturia. Prostatitis is an inflammation of the prostate. There are different types. You have acute bacterial prostatitis, which is due to E. coli or Pseudomonas. It will enlarge the prostate in response to inflammation. Symptoms are those of a UTI, malaise, low back pain, perineal pain, fever, chills, dysuria, urinary retention, or nocturia. Chronic bacterial prostatitis is another type, or prostodynia. Prostodynia means that you have pain in the prostate. Chronic bacterial prostatitis, you'll have recurrent UTIs with a gram-negative bacteria. Symptoms are similar to a bladder infection. Prostodynia, you have no history of a UTI, but you do have pain due to spasms. Non-bacterial prostatitis is due to the inflammatory reaction. There is no symptoms of a bacterial infection. It's the most common prostatitis syndrome. Symptoms are frequent urination, pain on ejaculation, and dull ache or pain. Cancer of the prostate is the most common cancer in American males. It is an adenocarcinoma. It is identified by an elevated PSA count. It is staged grade 1 to grade 5 with a Gleason score. Stage 1 means that it's microscopic and encapsulated. Stage 5 means that it is metastatic. In the United States, it tends to occur more in blacks and over the age of 65. Symptoms are none until it's well advanced. Then you have the symptoms of a bladder outlet obstruction, such as a decrease in stream, hesitancy, incomplete emptying of the bladder, frequency, nocturia, dysuria, bone pain, and enlarged lymph nodes. Late symptoms are of metastasis to the bone and the lymph. Risk factors are diets that are high in fat, particularly saturated fat, or low fiber and low complex carbohydrates with high protein, high hormone levels of your high androgens, having a vasectomy, chronic inflammation, genetic predisposition, low sunlight exposure because then your vitamin D will not be active. You'll have problems with your vitamin A because vitamins A, D, and selenium and lycopene are all thought to be protective against cancer of the prostate. And this is showing a picture of cancer of the prostate. Disorders of the breast, galactorrhea, is inappropriate lactation. This is secondary to any pathologic process elsewhere, such as hypothyroidism or excessive prolactin excretion. Fibrocystic changes are also called non-proliferative. You'll have palpable lumps in the breast. Fibrocystic changes are usually benign. They decrease after menopause, and you notice them mainly between the ages of 30 and 50. They may be related to estrogen levels, so they are affected by age, a number of pregnancies, the history of lactation, caffeine use, and exogenous hormones. They will fluctuate with menses, getting smaller and then larger. Breast cancer is an adenocarcinoma. This is the most common cancer in American women. It arises from ductal epithelium. It is possibly an autosomal dominant due to BRCA1 and BRCA2 genes. It spreads by way of the lymph to the base of the neck, the abdomen, the other breast, or bone. Risk factors are in a table on page 888, but they're like reproductive. Risk factors would be late menarche or early menopause, or being younger with your first child. Being younger with your first child is seen to be protective against cancer. Increased hormone levels will increase the risk. Environmental risks are radiation, diet, smoking, obesity, postmenopausal, being postmenopausal, your age at menarche, your alcohol use, and not exercising all increase the risk. And as I said, see that table on page 888. Symptoms are a painless lump, a dimpling of the tissue, a nipple skin retraction, and there's a table on 897 that goes into more detail. Treatment, if it's hormone replacement, if it needs estrogen in order to grow, remove the ovaries. And this is showing fibrocystic changes of the breast. You've got your normal breast on the left and the fibrocystic changes on the right. And this is a patient who came in to one of our local hospitals, a real patient, and you can see them holding her breast. This is the hand of the nurse here. This is the hand of the nurse. Whoops. And this is the tumor. This is a lymphoma the size of a hand. This woman was 68. Here's another picture of that breast, just the one breast with the lymphoma. It shows the breast tumor a little bit better. Gynecomastia in the male is hyperplasia of breast tissue. It affects about 32% of the men, particularly over the age of 50 and adolescents. It's usually due to a systemic disorder or medication, that's what the drugs are, neoplasms, or idiopathic. Hyperplasia results in a firm, palpable mass, at least 2 centimeters beneath the areola. Cancer of the breast tends to occur over the age of 60 in men, and it's very similar to that of women. Risk factors are gynecomastia, radiation of the chest wall, family history of breast cancer, and the presence of the BRCA2 gene has also been implicated in male breast cancer. Sexually transmitted infections. There's a table on page 900 in your textbook you need to look at. Bacterial infections. We've got gonorrhea or Neisseria. Gonorrhea is also called the clap. The clap is clapier in French, and that was French for brothel, or to increase the discharge. They would, for brothel. And when a man had this, to increase the discharge, they would clap the penis on both sides to eliminate the pus. It was first described in 1879. Humans are the only natural host. Males will incubate for 2 hours to 10 months. Females will incubate about 10 days. 30 to 60% are asymptomatic. The rest will have dysuria and a mucopurulent discharge. You'll also have dyspareunia, or painful intercourse. Risk factors are drug use, prostitution. It tends to occur mainly in ages 15 to 19 overall. Having an early onset or multiple partners, early onset of sex or multiple partners. A complication is pelvic inflammatory disease. Syphilis is caused by the Treponema pallidum spirochete. It is anaerobic, which means it cannot be cultured. It will form a canker, which is an eroded, painless nodular, firm with a lymph node enlargement. There are 4 stages if it's untreated. Stage 1 is primary, and you'll have a canker. Stage 2 is secondary, and you'll have systemic symptoms such as a low-grade fever, malaise, sore throat, anorexia, headache, joint pain, and rash. Stage 3 is latent, and that stage the patient's totally asymptomatic. And then you've got the tertiary stage, which is later stage 3, which is the most severe. This will attack the brain and the heart. Back in between 1932 and 1972, they did a Tuskegee study that studied 399 black males who had untreated syphilis. It shocks me that it went as late as 1972. In this Tuskegee study, 28 died directly. 100 died of complications. 40 wives were infected, and 19 children were born with congenital syphilis because they didn't tell the men that they had syphilis and were giving it to wives who didn't know they were in the study. This study changed the way in which research was conducted, as this was definitely one of the most unethical things we have ever done medically, because there was effective treatment available, and they did not give it. And the families were not informed, nor were they part of the study officially, and therefore they were not treated. So this is one of the things that this country did not do appropriately. This is showing the milky discharge of gonorrhea. This is showing the canker of syphilis. These are on penises. Chancroid, or Haemophilus ducreyi, is a soft canker. It was first discovered in 1852. It's rare in this country. The female is usually asymptomatic. The male will have lymphadenopathy and buboes. And buboes are fluid-filled inguinal lymph nodes. Symptoms occur after 4 to 7 days. Chlamydial infections, or chlamydia trachomatis, 70% of the females are asymptomatic. Chlamydia is the most common bacterial sexually transmitted infection in this country. Symptoms are painful urination, and it will cause conjunctivitis and pneumonia in newborns because they come through the birth canal. And this is showing the canker and the buboes. Viral infection. You've got genital herpes caused by the herpes simplex virus, where you'll have small multiple vesicular lesions. This is the same virus that causes cold sores. Patients are oftentimes asymptomatic, or if they're symptomatic, they'll have fever, malaise, myalgias, pruritus, and dysuria. So weakness, aching in your joints, itching, and painful urination. Genital warts are due to Condylomata acuminata, your HPV virus. The warts are soft, skin-colored, white to reddish-brown. They can bleed, and they can cause painful sex. And this is what genital warts look like in the male. And this is what they look like in the female. And again, in the female. And I think it probably would have sex in the dark. Parasitic infections, you've got trichomoniasis, which is Trichomonas vaginalis. It was first discovered named in 1836. It's mainly of the vagina. You're asymptomatic to frothy yellowish green or gray-green secretions. You'll have painful sex, painful urination. Then the men oftentimes are asymptomatic, which doesn't seem right. Scabies are transmitted skin to skin, or as a sexually transmitted infection. The mite will live 30 days and lays 2 to 3 eggs a day. The main complaint is itching. Scabies were the first human disease that was had a known cause, and that was back in 1637. And this is showing your scabies bites and their tunnels that occur. Pediculosis pubis is a crab louse. It lives 25 to 30 days. It's gray with claws. They're called crabs. Symptoms are bites, itching, redness, and inflammation. And this is pediculosis pubis. And this finishes the reproductive system.